Assalamualaikum warahmatullahi wabarakatuh. For today, I'm going to be presenting the pictures I've gathered about the four ways of knowing. The first one, okay, but first let me introduce myself. I am Hasreen Molana Fahad. First one is the empirical knowing. Empirical knowing refers to any scientific research-based, theoretical, factual information that the nurse make use of, meaning it focuses on factual scientific evidence and proven medical documentation used to treat patients. Most of this fact comes from the textbooks, training, and practical experiences gained in hospitals. Like, for example, through observation and practice, nurses learn to find veins, insert IV fluid, and etc. Because it mainly focuses and encourages nurses to use fact-based approaches to address patient needs. Second one, ethical knowing. Ethical knowing involves the judgment of right and wrong in relation in relation to difficult in relation to intentions, reasons, and attributes of individuals and situations. Some said it is one of the difficult because people hold different values and expectations. Moral and ethical decisions are made on a daily basis. The main basis for ethical knowing in the nursing profession is the code of ethics. Nurses, this is an example of nurse code of ethics. Nurses must learn to be sensitive to the moral values of others, especially if patients and family members hold values different from their own. Third, aesthetic knowing. This type of knowing is used in the process of giving appropriate nursing care through understanding the uniqueness of every patient. Thus, emphasize the use of creative and practical styles of care. As some said, it often the most difficult to apply to the nursing field because there are so many factors at play. Mainly focuses on empathy and also includes the nurse's ability to change ways in and manner of rendering nursing care based on the patient's individual needs and perceptions. The fourth one is personal knowing. Personal knowing is a type of knowing focused on realizing, defining the real true self, or in other words, self-awareness. This type of knowing takes nursing to a whole new level. Nurses must learn to emphasize with patients and their families as they face a difficult illnesses or injuries. According to Carper, this encourages the nurses to put themselves in their patient's shoes, so they will have the sensitivity and awareness to address not only physical needs but um mental and emotional ones too. Personal knowing is the understanding and actualization of relationship between a nurse and the patient. So that's all. Thank you for listening.